Dr. Jaffe, one of our customers writes in and says, how do traumatic brain injuries affect the gut-brain microbiome axis? He is thinking adrenal, mood, leaky gut, immune system, as well as vagus nerve connection. He'd like to know, how does he address this using PERC products and LRA testing, please?
Well, thank you for asking, because when we talk about traumatic brain injury, usually people think about automobile accidents or worksite accidents, fairly severe trauma. But I can tell you that many young people playing sports have what is the equivalent of a concussion, which is one of the aspects of traumatic brain injury. So my view, having survived my son who played football in high school, but it was Quaker football, so it was not as confrontational as it could have been. Anyway, I urge people to take seriously minimal brain injury, whatever you want to call it. Traumatic brain injury needs to be turned towards as an opportunity to repair and rehabilitate. And how do you repair and rehabilitate? Well, physiologically, you will need a lot of omega-3 fats. DHA for brain and body, EPA for body and brain. And how much? I would give 10 to 15 grams a day. I would check the omega-3 index, Bill Harris's index of balance of omega-3s, through our information resource, PERC Integrative Health. Please let us connect you. Then I would recognize that the people who have this kind of minimal brain, but please remember, in life, think of your brain like Jell-O contained within your skull, and within that a shock absorber called the dura mater. And when those are all working just fine, you can quote butt heads, just not too hard. But if I had people's attention and could show them the consequences for young young people, I mean, for school-age children, all the way through people who are electing to be physically active, which I want people to be. I want them well hydrated, I want them to be physically active, and I want them to enjoy nature, nurture, and wholeness. With that being said, I think there should be better neck and head support for every high school sport where there's any kind of contact. Football, soccer, head, whatever it's called. You can use your head to butt the ball in football or soccer. For adults who are in excellent physical shape and trained properly, they can do that without too much adverse effects. But very often young people are more eager than wise. And later, the lack of omega-3 in the brain, the lack of vitamin D to repair, it's a neurohormone for repair, the lack of ascorbate to set the redox potential so that the nerves want to repair, the lack of understanding in most cases, but I'm glad that the questioner understands the critical relationship between the two nervous systems. Now, there may be a third one, the cardiorespiratory nervous system, but at least there is a gut nervous system connected intimately and bidirectionally by the vagus highway, neurochemical highway. And we want people to have healthy neurohormones, neurochemicals, immune defense and repair, detoxification, and ability to be resilient and get restorative sleep. Very often, the reason that people find out about minimal brain injury is because the person presents with a sleep disorder or a mood disorder, or they can't concentrate in the afternoon, and their quality of life has been pulled in for reasons not clear. Now, there are today functional MRIs, such as pioneered by Richie Davidson and many others. There are ways of making non-invasive assessments of brain function. Let me give you two that you can do right now or soon after this, take a piece of paper, get 2 items about the size of what you think a silver dollar would be. Draw circles, preferably with a pencil, but draw circles about 6 inches apart. And now you put a pencil, a number 2 standard pencil, but with a sharp tip, sharp point. You put a pencil in someone's hand and you say, as fast as you can, but as accurately as you can, go back and forth and touch those 2 circles without making any touches outside the circles. That turns out to be the $2 test for neurocoordination years before catastrophe. So there are assessments, and we at Perk Integrative Health pioneered bringing those to the service of others. There are certain stress hormones that you can measure in saliva, as well as anabolic and catabolic, that is male and female or repair and recycling hormones, can be measured non-invasively in saliva. And we have pioneered the functional interpretation through Perk Integrative Health, through Health Studies Collegium, through the PIH Academy. And we are continuing to be excited about sharing with you the good news that there's a lot we can do together when we choose physiology before pharmacology, especially about how brain and body interact.